Hello again, it's Dr. Knox. I want to talk to you about some running injuries. What I want to talk to you today is Achilles tendonitis. Now, this is a common problem with runners because we're using the Achilles tendon so much as we're propulsing off the foot and in our stride. So it's a common thing that happens and is very painful, especially after rest. It's one of these problems that maybe as you get started, it hurts and it might loosen up during your run, but can be very painful after the run, especially if you've had several minutes of rest. What's happening with the Achilles tendon, which comes down the back of the leg and attaches to the middle portion of the back of the calcaneus or heel bone, is these tendon fibers will get swollen and they'll get damaged, and each of those little fibers will become enlarged. Sometimes you can even visually see the swelling in the back of the Achilles tendon and be very tender at that spot. When that happens, you've got to treat it with rest, elevation, and ice to try to get the inflammation down. And then ask yourself, am I stretching the back of my calf enough? This is the number one thing why this happens, is because your gastrocsoleus muscles are too tight. This is something that happens naturally as we age. We lose our flexibility in our muscles and our tendons. And so you need to start stretching the back of your calves on a regular basis throughout the day. Some of the studies have shown us that the best way to do this is called the eccentric stretching for the Achilles tendon. That is when you get on a stair, something that's raised, and you slowly go down with your injured foot. So your heel is below your toes. And instead of pushing up with that foot, you push up with your good foot. And then you do that over and over again, slowly lowering the heel of the injured foot and holding that at the bottom, thereby stretching the gastrocnemius muscle and the soleus muscles and stretching them out in the back of the leg. Achilles tendonitis, as I said, is very painful, as you know if you've had it. In rare cases, if nothing else is working, we can give you a steroid shot in the tendon, but we have to immobilize you afterwards in a boot. But normally we can get this taken care of without giving you shots and without surgery. So if you're having this problem, come in and talk to me about your running issues. I'd love to talk to you about that. Thanks.